Good morning, everybody. Welcome to this week's Mancoll Minute. Hope it's been a great week. So, one of the biggest, I think, things people need to understand about surgery, whether it's plastic surgery, cosmetic surgery, orthopedic surgery, so on, that the day of surgery is really important, but actually the day of, the recovery time is also critical. And people come in to see me and they have lots of things they want to do, a laundry list of stuff. And some people are very understanding when I say I can do, 1, 2, and 5 on your list, but we have to save 2 and 3 for something else. Or they just say, it's cheaper for me to do it all at once. I need, I don't have much downtime, so I've got to get all my recovery together. But at the end of the day, it all comes back down to safety. Safety of how much I can do during surgery, but then also really how much recovery can one go through. And although a lot of my patients are very strong, very stoic, not a lot of things slow them down, there is a point where the body just needs to rest. So when people say to me, all right, how much of the things that I want to do, like a mommy makeover is a great example of it, because we have some breast surgery, we have some abdominal surgery, we might have lipo in the front, back, legs, so on. How much can you do at one time? There's no one answer to that. But I have kind of thresholds that I use as a starting point for that. And one of them is about 6 hours for body contouring. And in that time period, I say, let's look at what you want to do and let's see what I can fill 6 hours up with, okay? Now, the caveat on that is, blood loss. Because as much as I don't want to lose any blood, particularly sometimes with liposuction, you have more blood loss than you want or you realize. So during the course of a case, I'll kind of modify what I do in some situations. If I feel like, I'm going to start having more blood loss than I'm comfortable with for someone to leave here, because it'll make you lightheaded and dizzy. Not a dangerous amount, by the way, but enough where it's sort of going to slow down your recovery, make it harder for you. And at the same time, if you're starting really anemic, then I don't have as much sort of threshold or as much to give or lose to get to that point. And then the other threshold for me is 5 liters of lipo is about the limit. Now, there are some occasions where I've done a little more, to be honest with you, and there's definitely cases where I've said, I can't get that much. Either there's not that much to get, or I don't want to take that much because, again, the aspirin's coming out pretty bloody. So when people say, again, well, how much lipo can I do? Can I do my arms, my legs, my belly, and so on? Well, it just depends on, one, how much is there in that territory, and how much do I guesstimate I think I'm going to get. And I'm pretty good at this stage to figure out how much I think I'm going to get off. So I understand and I appreciate the economics of doing more than one thing at a time, and I appreciate the kind of rolling all the recovery together at one time. But at the end of the day, for me to continue doing, and for any plastic surgeon to do what we do, we need to do it safely. That's where it starts and ends. These are elective operations. They're hard to justify if people get sick or have significant complications and problems. And not to mention, as a doctor, I feel terrible when things don't go perfect. And so I'm trying to make sure that I do everything in my power that I can control to have the safest, best outcome for patients. So, as I said, there's no one answer to that question about how much can I do at once, because everybody's different. People come with different pre-existing conditions, their blood counts, medications, help at home. There's so many factors, I think, that come into play to determine the final decision on what we do at one given surgery. And that's where I hope my judgment and who I am as a doctor becomes the adult in the room. Even though people may want to do everything at once, it doesn't mean we always should. And then I guess going along with this, one last thought is, well, what if I spend the night? Although presently in my practice, I don't have overnight. I do have arrangements at the hospital where I'm moving to, and my new place will have that. I think those thresholds are still going to hold true. Just because you get to spend one night with a nurse looking after you, because the recovery goes beyond one night, I think you have to keep all of those things in mind and consider those before we decide what's safe to do right now. So that might have been a little bit of a rambling type of explanation for those who asked that question, but I really feel like this is a one-on-one discussion that I have to have with patients when I take all of the factors in mind that I sort of figured out over 24 years make a difference. And even with that, sometimes it's kind of a guess. So Have a great weekend. Talk to you next week.